once a week at our county council meetings. Because the interest has been so high on this small business relief program, we have extended the deadline to May 31st. Our council members are working diligently with our mayors and other officials to identify small businesses who have the greatest need. And they will need time to process these applications because there has been an overwhelming response. While many businesses are going to be allowed to open today, not all businesses are on that list, and gyms are not on that list. But we recognize that exercise is a big part of our physical and emotional well-being, and we'll be working with gym owners to find them a pathway to reopen as soon as possible, but to do so safely, because we will always have a priority of keeping their employees safe and keeping their customers safe. As more people return to work, more people will be using our daycares. In St. Louis County, we allowed our daycares to stay open to take care of the children of our essential workers. And statewide, over half the daycares were closed. Guidelines for our daycares are available at stlcorona.com, and we hope that our daycare operators will be following closely our public health regulations. Parents can log on to stlcorona.com and look at those daycare regulations as well, so they'll know what to expect when they're dropping off their kids. We've had a lot of questions about summer day camps, and we expect those to reopen this summer as well. We'll have more guidelines on summer day camps later this week, but those will be very similar to daycares. We understand how important day camps are for enrichment for our kids, but also a place for kids to go when school's out in the summer. In this reopening, we will continue to expand testing. We are receiving more tests from the state, in addition to the ones that we are able to purchase for St. Louis County, and we will continue to aggressively compete to be able to purchase tests. In addition, testing is available in our community through private labs, through hospital systems, and through our federally qualified healthcare centers. We will be able to test everyone in St. Louis County through one of these resources when they have symptoms. And we will continue to provide testing for anyone who is asymptomatic and is in a high-risk population. With more testing in our community, we can expect the number of cases of COVID-19 to increase, and we'll be watching this very closely. The virus is still present in our community, it's still very contagious, and we need to be cautious as we return to this new normal. We will closely be monitoring the number of positive tests and the number of negative tests. We'll also be watching hospital admissions. This is one of the best monitors of how we're doing in the community with social distancing. We'll be listening to our hospital systems, our pandemic task force, and our public health officials as we make decisions on the next phase of reopening. We'll continue to work with our high-risk populations, especially our nursing homes, to make sure that they have the PPE that they need, they have the testing that they need, and they have the guidance and education that they need. Last week, we awarded 5 grants totaling $2.6 million for food to agencies who have a long history of providing these services in our community, and this will help thousands of families in these very challenging times. And as these challenging times continue, we will also continue to have sick friends, co-workers, and family members. People are still hospitalized. Doctors and scientists are still working furiously to understand this virus and to develop a vaccine. We don't expect a vaccine to be widely available until the end of the year. And until then, we'll continue to move forward safely, slowly, with the partial reopening of our economy and getting our small businesses working again. Moving forward together, we believe this is the best pathway. And I'll be glad to answer any questions.
You kind of mentioned gyms. We've had a few gym owners reach out to us asking, why can nail salons open when like Pilates studios which have, one-on-one interaction cannot? Do you mind responding to that?
Yeah, we're following the guidance of our public health officials, and we see this across the country. Gyms are traditionally in a second wave because of their high risk of transmission of COVID-19, especially on their equipment. And we'll be working with gym owners this week. We have at least one meeting set up to come up with a pathway to move forward. We're sensitive to their concerns, and we want to see them reopen too. and we'll have a plan to do so safely in a way that protects their patients, their customers, their employees.
Clarify some of the mask requirements. When are they required, when are they encouraged, and how will it be enforced?
Well, masks will be required for businesses, for employees, along with social distancing, along with screening of their employees when they come to work, widely available hand sanitizer, social distancing, clearly marked within their places of employment. We will highly and strongly recommend people wear masks whenever they're out in public. We do not intend to enforce that. I believe peer pressure and common sense will enforce that. What I've seen in our community is that just about everyone wants to know what the right thing to do is so they can do it. We understand how devastating this virus has been, how contagious it has been, and what great harm it's done to our economy and to people's lives as we try to deal with it. But I believe peer pressure will be the greatest. We will certainly occasionally have outliers. I don't expect a lot of businesses to be outliers from our guidelines because their customers will be the best enforcement. And if someone doesn't appear safe, if someone doesn't inspire confidence, I think they will have a hard time attracting customers. And I would encourage our residents to log on to stlcorona.com and look at those business guidelines so they'll know what to expect when they go into a restaurant or retail operation. But the response we've received from the business community asking for guidance, asking to know what the right thing to do is, tells me that the vast majority of individuals, of businesses, are going to do the right thing.
I've seen places who've already reopened, they've kind of, some have set the 2-week mark. After 2 weeks, it kind of lets them know how well the reopening is going. I've read other articles and seen on the data that says that's not soon enough. It takes 4, 5, 6 weeks. Do you guys have a statement on that? Are we going to look at
Right. So there's two trends that we have to watch. We have to watch the continuing falling trend because of the social distancing guidelines that we have initiated, and that will continue to fall slowly over the next couple of weeks. On top of that trend is any trends that might be impacted by an increased spread in the community because of relaxing our stay-at-home orders. So this will be absolutely a test of how widely individuals in our community adopt social distancing policies, avoid crowds, wear masks when they're out in public, use hand sanitizer, wash your hands with soap and water, stay home when you're sick, all these things that are important. So 2 weeks is about a good average. I think 2, maybe 3 weeks will kind of tell us where we're going. But we'll be watching our test results as we get much more testing available in our community, not just the positive tests, but the positive to negative ratio of tests. But the best marker right now is hospital admissions. So we'll be watching that hospital admission trend very closely.
Do you think in 2 to 3 weeks we'll have a good idea of how phase 1 is
Right.
going?
Right.
When do you expect to give guidance for nursing homes or lifting the lockdowns?
Well, we've been giving guidance for nursing homes from the beginning, and we'll continue to do so. We have a high-risk task force that regularly communicates with nursing homes. We've provided PPE to over 50 nursing homes in our community, and we'll continue to help any of them that ask for help. That's a high priority for us because it's high risk. These are our family members, mothers and fathers and sisters and brothers who are in very difficult situations with chronic medical problems living close together. This is a very high-risk environment, and that's why we're testing even asymptomatic people in nursing homes.
One last question for you, because a lot of my coworkers they were planning to get married this year. And they want to know, obviously, 10 or fewer at this point when it comes to public things and in your home. Any idea when that could be loosened or kind of, expanded a little bit? I know it's still early. I know you all are tracking it, but any idea when that could be?
Well, we'll look at expanding some of our guidelines in June, but large gatherings are the highest risk type of event. 1 or 2 individuals can spread the virus to hundreds or dozens, which will move very quickly in a community. And if we look historically across our country, that's how a lot of the catastrophes have developed in other communities. So we hope to get there. It depends on how widely accepted social distancing is and how this trend changes because of from the opening, this limited partial first step reopening. We'll be watching that trend very closely. We certainly respect the desire of folks to want to have normal weddings, and we'd like to get them there. That's a very important life event, and we'd like to see those be able to happen not entirely on video, which is how a lot of them have happened recently.
Did you say, just to clarify, at this point, we have enough tests for everyone in St. Louis County who is showing symptoms to be tested?
Yeah, so this week we believe anyone who has symptoms will be able to get to a test if they want to be tested, which I think would be important. And through our network, through private labs, through federally qualified health centers, through the county public health department, through hospital systems, as we are getting more tests into place, we believe that folks with symptoms, regardless of whether or not they are high risk, should be able to get a test so they'll know whether or not they need to be isolated or they can move on with the rest of their life. That's a very important marker of progress. And then being able to test asymptomatic people in high-risk populations, we're already doing some of that. We will increase that. That testing is important too. So the amount of tests that are in the possession of St. Louis County Department of Public Health is part of this equation. The tests that the state sends us as part of this equation, they're sending us more tests this week, but also the tests that are already available in the community, that's part of the equation as well. And we have a lot of the testing in St. Louis County is done through federally qualified health centers, through private labs, through urgent care centers, and through hospital systems, in addition to what St. Louis County does.
Sam, we have a series of questions. The St. Louis American is asking, what are the guidelines for open air events, including farmers markets and food trucks? Is there a limit on the number of people that can gather at outdoor events? I think it kind of plays off the wedding question.
Yeah, you know, outdoor events are certainly less risk than indoor events, but still crowds and outdoor events are a challenge. We still want people to social distance at those farmers markets. We want them to have masks on. It still is a possibility for a transmission. But I would treat those events like treat a grocery store, avoid crowding, social distancing, wear a mask.
Is there a limit on the number of people who can gather at the outdoor events?
Well, you know, it's hard to limit someone in an open space without walls. I would just recognize that you want to use social distancing, follow guidelines, avoid crowds as much as possible, don't have intentional gatherings, get into an event like that and get what you need and move on.
Some early childhood education providers are concerned they don't have sufficient PPE and cleaning supplies. They're asking for support, short-term as well as long-term. Is the county in a position to do that, or are they doing that?
Yeah, I think we're already working with some child care providers, some daycare providers, and I think we'll continue to do that. If they can't get PPE, then you know, we should be in the position to help them. And that's one of the things that we'll be doing to help daycares.
And then for Channel 5, we have a couple questions. With some of the businesses reopening, does the enforcement mechanism change? That is, if a police officer drives by and sees a gathering that's clearly violating the restrictions, would misdemeanor violations be handed out? If so, to whom? Or would the enforcement not be done on the spot?
Well, I think initially we would treat this like any other episode of bad judgment that a police officer would witness. And I would imagine that they would say, hey guys, you want to be safe. But you know, we are aware that there are some groups out there that are looking for confrontation around this, and we're just not interested. I think it will continue to be difficult to find large groups of people with bad judgment who want to come together. The vast majority of people in our community just want to know what the right thing is to do, what the safe thing is to do, and to be safe for themselves and be safe for the people around them. So I think this will continue to be a rare event that we'll monitor on a case-by-case scenario.
Let's go. One more question, also from Channel 5. You mentioned that the county is ordering saliva tests to replace the more invasive nasal test. Is there a timeline for when those will arrive, and is there any concern about the accuracy of those tests?
Anytime there's a new test, there's always concern about accuracy, and that's why we'll perform a validation study. When those tests arrive, we'll do them simultaneously with the traditional nasopharyngeal swabs and make sure that they're accurate. But the saliva tests are new. They're coming onto the market, and I don't know the timeline for those to arrive. I just know that one of the responses to our bids was for saliva tests, and we're going to be trying to acquire them, competing with everyone else in the country, and to have them available in our community.
I just have one question. I know that in some cities, like Kirkwood, for example, restaurant owners have come to the city and asked, hey, could we look at shutting down some streets in order to make it easier to social distance and space for tables? You all have requests like that from restaurants, and are you working with them to possibly do street closures to provide more space?
I haven't heard of that, but I'm not involved in all the details of this. They may be talking to our health department. It sounds like an interesting idea and something that we could consider expanding outdoor seating. As long as we have adequate social distancing, I think those are all possibilities. Okay, thank you.
To all healthcare workers all over the world for their sterling work. Madam President, COVID-19 poses a serious threat to the health of people in the African continent. We have been struggling with fragile healthcare systems for many years, and African countries believe that it is vital that concerted efforts take place between the national and international levels to combat the pandemic. Therefore, we need to stress coordination and cooperation in our efforts. That's why the African group has set up a group of experts from the African CDC and a coordinating committee at ministerial level. It's also created a COVID-19 response fund, and we thank all African ministers for their involvement in these efforts. Our common strategy to fight COVID-19 is focusing on reducing transmission and trying to mitigate the socioeconomic impact. The African CDC, with its regional collaborating centers, continue to support the member states of the African Union in their efforts to respond to the pandemic. And we also have been enjoying the support of WHO and all of our other partners. Madam President, the African region also realizes that we need to continue with our efforts to promote primary health care, to step up UHC, and to try to attain the highest possible level of health and well-being for all. And we encourage all countries to strengthen their healthcare systems in order to try to achieve the SDGs by 2030. We still have a great deal to do, but health for all should be our focus as we continue